Right, Bill, as we said, the Republicans not giving up without a fight. They are ready for battle. And Republican Governor of Minnesota, Tim Pawlenty, is good enough to join us this morning. Governor, thank you so much. I know you were hearing David Axelrod, and you heard what he said at the end there, that they expected these lawsuits and they're not worried about them. Will you continue to press forward?
Well, absolutely. I sent a letter yesterday to my Attorney General, who happens to be on the other side of the aisle, saying that this does look like an unprecedented overreach by the federal government forcing individual citizens to buy a good or a service for no other reason than they happen to be alive or a person. That seems to be unprecedented. Even the Congressional Budget Office said so in a report in the 1990s.
Well, how do you respond to the critics who say this is nothing more than an attempt to gut the bill, and why not spend time and energy on trying to make it work the best way it can?
Well, Robin, the nation faces big challenges, and we do need to fix our health care system, but they've taken it to this big, federalized, bureaucratic, government-run kind of nanny nation approach, and there were better ways to do it. They should have worked with us on those better ways. But as to the point that you raise, I don't think defending the Constitution and individuals' rights under the Constitutions and the relationship between states and the federal government under the Constitution is a frivolous matter. It's a foundational matter, and it's an important one for our nation.
And it's one that, of course, you and others share. But what about the successful efforts by your Republican counterparts to reform health care in their respective states? Mitt Romney in Massachusetts, for example. Do you think that was a bad idea?
Well, I think what is a good idea is not having the government take these systems over. Republicans across the country, including here in Minnesota, have good ideas that we could have agreed on if President Obama and the Democrats would have set aside their version of the ideal and worked with us on a bipartisan basis. Those things could have included things like pre-existing conditions, including allowing children to stay on their parents' health insurance a little longer, including having transparency in pricing in a market where consumers in charge, including malpractice reform and tort reform, and down the list. There were 10 or 15 really good reforms that both sides could have agreed on if President Obama and the Democrats would have set aside their obsession with things from the 1960s or the European approach to these things. It's not going to work. They've got every entitlement program they currently run is bankrupt. This one will be bankrupt within 20 years as well. You
talk about obsession. This took about 13 months to finally get this passed, and there was attempts on both sides and good intentions on both sides of the aisle. How did this become such a political football, do you think?
Well, I think for conservatives, we underestimate just how powerful that this government-run, single-payer, federal health care obsession is within the Democratic Party or the liberal movement. It's something they've been working on for 30 years, and they were more interested in achieving that ideological or political goal rather than working with Republicans to get something done. And again, if each side would have set aside those few things that they can agree on, there was a good dozen, at least, ideas that would have significantly and incrementally helped this system for quality, for cost containment, for expanding access, and they rejected those ideas for the most part.
And some things that didn't help, and I don't know if you agree or not, the tone that it took, especially at the end there when you heard slurs and other things. I want to play something that Barry Frank said in responding to a homophobic slur that was directed at him.
But there are leaders in the Republican Party and elsewhere who kind of egg these people on, who legitimize not simple disagreement with the bill, which is, of course, what people should be doing, but denunciation of people's motives, a degree of personal abuse.
Barney Frank saying, of course you can disagree. That's the American way, but the manner in which it has taken, do you agree with him that in some ways it's being egged on?
Name-calling and attacking people personally or their personal characteristics is inappropriate, and in some cases what you heard there was just absolutely absurd in terms of what people were yelling or chanting, and that should not happen. It was inappropriate. We can have disagreements, but we should have disagreements on the issues, on the substance, and we should treat each other civilly and thoughtfully and fairly as best we can. There's always going to be tension. There's always going to be heat in these debates, but let's debate the issues. Let's not debate people's personal characteristics.
I think that is something we can all agree on. Governor Pawlenty, thank you so much for weighing in this morning.
Thank you, Robert.
For your time. We appreciate it. Have a good day. And later this morning,
thank you.
Okay, we will